Hip pain that leads to joint replacement can really sneak up on people. A lot of times they think they may have pulled a groin muscle. It starts off as some kind of nebulous pain, hard to identify, and then often they're surprised when x-rays show, wow, your hip is pretty worn out. And then they get even more floored when they're told you might need a hip replacement. It is something where nowadays we don't have to cut any muscle to replace the hip. We can do it through tiny incisions. We can use robotics to very precisely place the implants so that they last a long time, feel better, quicker. The Mako robot technology utilizes 3D modeling to virtually plan the patient's joint replacement before we actually carry it out. So we're looking at a 3D model on a computer, and we can exactly place the implants where we want them on that model, and then we execute exactly what we planned in real life for the patient in a short amount of time, close them up, and they're walking around later that day.